Okay, it's apparently the time of the year when kids are getting assignments regarding careers or forensic class or something. As you know, I have a video on this page, which is probably like 20 minutes long, because I used to get at the beginning of every semester for high school and the fall semester and the winter semester, I would get these long list of interview questions, and people want to interview me. I get, dozens of direct messages asking me for an interview. I can't respond to all those because I get like somewhere between 50 and 100 messages a day across all my social media and emails and stuff like that. And I simply can't do it. I can't imagine how someone is that's actually, prominent and famous. I remember when I was a kid, Garfield was at its absolute height of popularity. So kind of like mid 80s. And I actually wrote Jim Davis a letter. And he wrote me back. Like, he literally wrote me back. It's like the best thing that's ever happened in my life. I unfortunately cannot do that. And Jim Davis was probably getting like 10,000 letters a month. So I don't know how he did it. But anyway, I have a number of questions. I'm going to try to go through them. And then whoever's watching this can just fill in their little reports or interview things. And hopefully this will cover everyone, because the questions are just a bit different depending on who's sending it to me. But here we go. When did you know that you wanted to pursue your career? Well, first of all, I have a career within a career. So I am a medical doctor, but as a medical doctor, I am a forensic and a surgical pathologist. So in some ways, I guess you could say I have three careers. But let's just assume that you're asking about forensics. So I have already completed medical school. I have pretty much already completed residency program, and I'm a surgical pathologist. I did not decide on forensics until after I had been working as a surgical pathologist for a while. I was in my 30s, basically, when I decided to do that. Because like I said, I was a surgical pathologist from like 2008 to 2015 full time, or I guess it was 2014. From about 2015 to today, I've been an autopsy pathologist, and there was a little overlap there. So it was not early. Number two, can working as a forensic pathologist be draining mentally? Yes, it can be, for a couple of different reasons. The cases can sometimes be long and difficult. So when you have a week where you have a lot of difficult cases like homicides, a lot of gunshot wounds and stab wounds, a lot of other cases that might be physically taxing on top of mentally taxing, okay? So, it is definitely a mentally draining career. I don't know how people stay in it for 50 years, because, there are people out there right now who they've been doing it for 50 years. And I don't think it's if you work in a good group, you could probably pull that off where you can have like lots of vacation and stuff. I personally don't have partners. I am my own entity, my own business entity. So I am the only person that can cover, find vacation coverage and stuff. So yeah, it is exhausting, but it's also rewarding as well. Medicine in general is going to be mentally exhausting if you're not prepared for it. Was it hard adjusting to seeing dead bodies daily when you first started being a forensic pathologist? No. It is what it is. Like, if you're not mentally into that, like checked in, it's going to be hard for you. But you know what to expect. So it really didn't bother me that much, to be honest. Let's see. Do you talk to the person who is dead, their loved ones, or is that somebody else's job? So it's both. I do not talk to every patient's family on every case. There are some cases where they have to have the expert explain it, because there's nobody else who can explain it but me. So yeah, I mean, occasionally, but not every case. Now, when I do private cases for families where they are asking me to do the autopsy, they pretty much already know what the cause of death is, but they just want more information. In those cases, I will explain to them. I'll usually talk to them on the phone and have like a conference with them. And I will also send them a letter explaining everything so that they can take that to the doctor that is their family physician and let them work that out. But I usually have someone from the office explain things. So usually when it's easy stuff, like for instance, if somebody dies of a heart attack, I don't need to deliver that information. That is deliverable by the coroner. What career do you think you would have pursued instead of forensic pathology? So that's difficult to say. I mean, I was also interviewing for emergency medicine when I was interviewing for pathology at the same time. So I would say probably it would be emergency medicine. I was looking for a career that gave me a fair amount of free time, but where the work was also rewarding. And so those were my last two options when I was in medical school. All right, what was the route you took to get into pathology? All right, 4 years of 4 years of college, and I got a microbiology degree, 4 years of medical school, 4 years of pathology residency, and then at that point you can be a pathologist. But for forensics, I have to take an extra year of forensic training. So it's a minimum of 12 and then to be a pathologist, really. And then, 13 or 14 to be a subspecialist like I am. What has been the most exciting part about being a pathologist? The good thing about being a pathologist is that you get to know pretty much every type of disease and every diagnosis. And that's rewarding because you feel like you've gotten the most out of your medical education. I mean, I have a basis to understand every human disease. That's good. The other would be that, pretty much every day is something new. You're going to see something that's either a variant or it's something that you've never seen before and it's unpredictable. So that keeps it fresh. After dealing with many dead bodies, what is it that encourages you to stay in the field? I would say that question, dealing with death doesn't discourage me or other pathologists from being in the field because we chose this career. We know that death is a central part of it. But to your point, what encourages me to stay? Well, you have to have intellectual curiosity, which which my intellectual curiosity is fulfilled by my cases. And secondly, there are things like bringing closure to families and bringing justice for criminal cases. What is the most complicated case you've dealt with? There are cases that are probably my most complicated that I can't even talk about publicly because they are unresolved potential murder cases. So, unfortunately, I can't answer that question honestly, but I can say that I've had cases where there have been over 100 gunshot wounds, and I've had cases where there have been over 100 stab wounds. And those are complex because they take many, many hours, and they also involve lots of measurement and lots of precise dissection. How has being in the pathology field changed the way I view death? I would say it has not changed a whole lot about the way I view death. It's one of those things that you become accustomed to seeing death, to seeing trauma, to seeing unfortunately innocent people lose lives, and seeing people who woke up that day thinking that they were going to make it to the end of the day and didn't. So I guess my feeling about that would be that it makes you appreciate life more. I think maybe that's the end point of dealing with so much death, which is either unexpected or senseless. All right, so a few more questions here. What is your average day of work as a pathologist? I think what they're asking is, what is your day like? And, it depends. It depends. If you're talking about surgical pathology, that's a 9 to 4 job or an 8 to 5 job. You're going to come in, you're going to get your cases, you're going to look at them in the microscope, you're going to sign them out, and do all that stuff. And then you're going to go do procedures in the operating room with the surgeons, frozen sections, for instance. You're going to process the organs that have been removed in surgery to decide, or to diagnose the pathology that may or may not be present. So those are banker type hours. Now, if you're talking about autopsy pathology, those hours are actually shorter. Usually, when I was at my busiest, I was still done at noon every day, or maybe 1, starting at about 6 or 7, maybe 8. So not bad at all. And also, you don't, depending on your practice, you don't necessarily have to work every day. There were times that I would have 2 or 3 days off in a row, and then I would work one day and then maybe a day off and work another day. But I might have 8 or 10 autopsies on those 2 days. So it's really unpredictable for the forensic side, because we can't predict, death isn't on a schedule, basically. Whereas with surgical pathology, our schedule is dictated by the surgeons, right? Because surgeons are going to operate from 7 to 2 or 7 to 3 at most hospitals, not including their on-call stuff. And we have to be able to be available to prepare their specimens, okay? Is your line of work difficult or easy? I would say that this is one of the more difficult areas of medicine for a couple of reasons. One, you have to know everything. You can't just say, I'm only going to study gastrointestinal diseases. You have to know everything head to toe. You also have to know the basics of surgical procedures, because sometimes people die during surgery, and you have to be able to assess whether or not the surgical procedure was going appropriately and things like that. So you have to know all about drugs and pharmaceuticals, because that's a big part of the case, is looking at what compounds were in the person's body. You have to do a lot for forensics. You have to do a lot of legal work. So you have to review tons and tons of medical records. You have to write long reports, and those reports cannot have errors. So you might have a 15-page report, and one typo or one little mistake, right for left or something like that, can get you in trouble when it comes time for those to go to trial, or when those are being evaluated for insurance purposes. So there's a lot of pressure to get stuff right. Whether or not you're surgical or you're forensic, there's a ton of pressure to get everything right. Because if you get things wrong in surgical, if you get something wrong, a person might suffer. A person might have cancer, and you said that they didn't. Or you might say that a person had cancer and they get a procedure they don't need, which means that then you're going to get sued. For forensics, you have to be correct, because if you get it wrong in the autopsy, then somebody may have been murdered, and that murderer will walk free. Likewise, if you say it's a murder and it's not, then an innocent person will go to jail. So it's a job with a lot of pressure. The only advantage that we have over maybe some other doctors is that we generally don't have to make the decision instantaneously and with no help. So if I have a difficult surgical case, let's say it's a lung tumor or something, and I look at it and I think, okay, well, I think I know what this lung tumor is. Let me ask my fellow down the hall. Let me ask someone down the hall and see if they agree, and they can agree. And likewise, with forensic stuff, if things are very confusing or very difficult, you can always ask somebody else their opinion. So in that sense, it is good. It is not too bad given the level of pressure that you have to get everything right. What made me decide to get into the career? That is, like I said earlier in the video, what made me decide was I like knowing a lot about medicine. I like having the answer at the end of the day. You know, some folks go to the doctor and they give their doctor the symptoms, and the doctor says, well, I think it could be X, Y, or Z. Whereas the pathologist knows. I'm not saying we know better than that physician, but when we are given a problem, we create a diagnosis for that particular problem. So you leave work every day knowing that you have given an answer for the most part. Most interesting parts of my career, again, similar to earlier, would be the variability of this career. So you see something new, especially in forensics. You will see something new almost every week. Maybe not every day if you've been in the field a fair amount of time like I have, but you know, it's the variability is nice. What advice would I give to someone who wants to be in this line of work? Well, first of all, you have to have good grades. So you can't get into medical school with bad grades. So I would say you have to study hard. Keep your grades up. You need to be very detail-oriented because details are the most important part of any field of pathology. And you have to be able to, I think the number one thing, and this applies not just to my field, but all forms of medicine and really any career, is to know or be comfortable with what you don't know. For example, I am very good at things like breast pathology, gastrointestinal pathology, things like that. But when it comes to, like, let's say brain tumor pathology, that is such a specialized field that I might be able to make the diagnosis, but I would not be comfortable signing that out without having a neuropathologist, a brain pathologist, look at that case. So I know in my heart, if I have a brain tumor, there's a good chance I might be able to get it right, but I know that I'm not an expert in brain tumor pathology. Maybe at one point I was many years ago, but I don't see that stuff very much anymore. So that's just one example, that to know and recognize what you don't know. All right, so I think those are all the questions that I have received, or at least a variant of the questions that I have received, which should be able to answer the questions that were asked to me. And if you know anybody who has such an assignment and they want answers, they're going to have to just watch this video or the previous video that I made. I guess it was a couple years ago, 2 or 3 years ago. So hopefully this was helpful. And I guess if you have any additional questions, you can comment on this video.